Okay, I've done a number of videos on this. We're going to talk once again about blood sugar. This is probably the most common problem, one of the easiest to fix, and it's a thing that if you don't fix, nothing else gets better. So let's talk about blood sugar. Okay, so a lot of people, first of all, a lot of people will say, my blood sugar was fine, my doctor checked it. They most likely checked a fasting blood sugar. They did not do a hemoglobin A1C or fasting insulin. We're going to go over that in a second, okay? But suffice to say that you need those three things, okay? So first, blood sugar. What are the symptoms of blood sugar? Fatigue, weight gain, hormonal fluctuations, anxiety, depression, insomnia, inflammation, immune system issues, and wounds that won't heal. This sounds a lot like other things, okay? A lot of times if you, let's say you go to a website for Lyme disease and you enter your symptoms and it says, yeah, you probably have Lyme disease. You may also have blood sugar problems. In fact, I have seen at least 50% of people that think they had Lyme disease, actually the blood sugar was a bigger problem. Or like I had a person come in who swore that she had thyroid problems. In fact, she had been diagnosed with Hashimoto's thyroiditis. And she stopped having her period, her thyroid levels are off, and she said something's wrong, and she said, I think I need more thyroid meds. I said, let's check your blood sugar. She was pre-diabetic. Okay, once she fixed her diet, boom. And by the way, her diet was not that bad. She was just eating a little bit too much fruit. So some people are very, very sensitive. Also, some people think like anxiety, depression, insomnia, they're like, all right, well, you know, I've just got anxiety, and they'll want to take a drug for it. If you look, a lot of these people have blood sugar problems. Okay, what happens with blood sugar problems is not only does it throw off your hormones, especially your stress hormones, but it'll also throw off your estrogen, testosterone, progesterone. It'll also, actually, sometimes what happens is your cells will shut down, shuttling blood sugar into them, and so you'll feel like garbage, okay? It can look like anxiety and depression. And of course, immune system issues, like I said, with people will, sometimes they think they have chronic fatigue, fibromyalgia, those types of things. They're actually blood sugar issues, sometimes. Blood sugar issues must be taken care of if you're going to handle heart disease, cancer, diabetes, Alzheimer's, arthritis, chronic pain, and chronic infection. They are not, blood sugar is not present 100% of the time in these cases, but if you look at the statistics, okay, and the studies, they are present 80% of the time, okay? 80% of our chronic health disease in this country, which are heart disease, cancer, diabetes, Alzheimer's, arthritis, chronic pain, chronic infection, 80% of it is due to lifestyle, including blood sugar. Okay, so what to look for on your blood sugar tests. This is taken right from Dr. Moore, The Blood Code. You can look at his book. Awesome. Okay. But I'm going to go over it right here as well. Okay. Make sure, I will tell you the ones that you absolutely need that are not run by most doctors. Do you have a pen back there? Do you have a marker? No? All right. Well, I'll just run it right in my pen. The things that you absolutely, oh, you got that. Here, let me see that. Let me grab the big one. Hopefully it doesn't bleed through. Okay, the absolute musts are the fasting glucose, the fasting insulin, and the HA1C. Okay? The other ones are important, but to assess for blood sugar, you absolutely need these three. And these are the values that you're supposed to have. By the way, a lot of people say that I have another video out there that compares the functional lab reference range, which is basically the optimum lab reference range, okay, versus the lab reference range. I have a video about that. But basically, the functional lab reference range is an optimum range, and the standard lab reference range is just an average. And who's it an average of? Sick people. And so you want to compare yourself to other healthy people, the functional reference range, the optimum range, versus the standard lab reference range. And that's what I'm going to show you right here. But most doctors will say, as long as you don't have high blood sugar, your blood sugar is okay. That is a fail. You should have optimum blood sugar. Before your blood sugar goes sky high, it'll start to rise. It'll go over 85. So the first thing we want to check is fasting blood sugar. or fasting glucose. It should be between 70 and 85 for optimum health. The next one is what's called fasting insulin. A little bit of a mistake here. Let me fix this. Technicality. Okay, so your your fasting insulin should be below 6. Okay, what insulin does is it works to shuttle blood sugar into your cells, fat cells, muscle cells, nerve cells, that type of thing. Okay, and what happens is you want to have a good amount. People say, well, more would be better. That is not true. If you have too much insulin, what it means is that, what happens is if you have too high blood sugar, your body says, you know what, I don't want any more in these cells. And it'll actually start shutting down that transport. It becomes what's called insulin resistant. And so what your body does, the body's very smart. It says, well, listen, I'm going to starve, and so I'm going to produce more insulin. And so your insulin level, it'll go up. So that will show you when you're starting to develop insulin problems, when you're starting to develop blood sugar problems. That's why you always check the fasting insulin. By the way, I have never seen a medical doctor check the fasting insulin, even though in our textbook, we have the same textbook as medical doctors. I'm a chiropractor. We have one called Mosby's. Okay, it's Mosby's Physiology, I believe it is. But they actually say that fasting insulin changes precede other blood sugar disorders by years. It literally says that. Okay, so that's the other one that we need. The other thing that we need is what's called an HA1C, hemoglobin A1C. Hemoglobin A1C is a measure of how much sugar is attached to hemoglobin, which hemoglobin is in your red blood cells, which live for usually 3 to 4 months, okay, before they're recycled, broken down, that kind of thing. And what happens is if you have a higher HA1C, hemoglobin A1C, it means that you have had higher blood sugar over that 3 to 4 month period. And so fasting glucose tells you what your blood sugar is at that point, that day. Fasting insulin tells us how hard your body is working to keep that blood sugar down. And hemoglobin A1C tells us what that average blood sugar is over time. All three of those things need to be known to assess blood sugar properly. And they're reflected over in here, if you notice. Fasting glucose, fasting insulin, hemoglobin A1C. There's also other things called HOMA-IR, triglycerides. Triglycerides are a blood fat. What happens is if your body has too much sugar, it starts to convert it into fat. And one of the intermediary products is triglycerides. Okay, if your triglycerides are over 100, it means that your body is working really hard to convert sugar into fat. Okay, that's a big problem. HDL, high density lipoprotein. This is considered the good cholesterol, and so you want more of it. Okay, it should be over 55. There's also what's called the HDL triglyceride ratio. Basically, the triglycerides should be no more than twice what the triglycerides should be no more than twice what the HDLs are. Okay, so a ratio of 1 to 2. So let's say you have an HDL of 55, your triglycerides should be less than 110. It kind of correlates with this other number in here. Okay, and then you have what's called the HOMA-IR. I don't remember exactly what it stands for, but basically it's a measure of your fasting insulin times your glucose divided by 405. That number, okay, if you look here, no insulin resistance should be between 0.5 and 1.5. Slight insulin resistance is when it's over 1.5. Moderate is over 2.5, and severe is over 3. This correlates really well to slight insulin resistance is usually when the fasting insulin is over 6. Okay, the moderate insulin resistance is when insulin is over 10, HOMA-IR is over 2.5, and severe is when the fasting insulin is over 12 and the HOMA-IR is over 3. I've just done a lot of these, and that tends to be what correlates. Remember though, you must have these three, okay, to properly assess. By the way, come back to this over and over and over again. It's a very simple explanation, okay? So, how to improve your blood sugar markers. People say, all right, I got a problem. What do I do about it? very easy. We have a video called the Page Diet. Look at it. You do what's called, by the way, there's a bunch of different ways to do it. I'm going to tell you what we do because I treat hundreds, if not thousands of patients now. And you want to know what works without screwing things up. Okay? First rule of thumb in life is don't screw it up. Second is improve. Okay? So you start the Page Diet. Page Diet, this was developed by a doctor named Dr. Page, and he saw how to optimize people's blood chemistry using food. Very, very smart, right? Not drugs. And what he found was that basically you should have a diet that's protein and vegetables. It's the predecessor of the carnivore diet. It's the predecessor of the paleo diet, the keto diet, all those types of things. It's the Page Diet. Look on our website, we have the Page Diet. If your HOMAIR is less than 3, do phase 2. There's 2 phases of it. Phase 1 is more of like a detoxification and it gives you like rapid results. You do phase 1 if your HOMAIR is over 3 or if your fasting insulin is over 12. Remember that? The other thing is if your HOMAIR is over 3, give the person, there's a company that we use a lot called Center Process and MediHerb. They have something called Metabolic Complex. You take 3 of those a day, 3 Gymnema, and 3 berberine. Okay? If you take 3 of each of these, what they do is they'll help to lower your blood sugar. Okay, so it'll make it work even that much better. So if you have a real blood sugar problem, you can go and give them phase 1 Page Diet with Metabolic Complex, Gymnema, and berberine. We're going to put links down below on how to do that. If you want, there's another company called Systemic Formulas, and they have something called Sinulin, and I think you're supposed to take 2 or 3 of those a day if you want. Whichever company you want to have. I don't have an alliance with either one. Okay? But that's what you do. Starts with diet. Look at the Page Diet. By the way, people say, well, what about the keto diet? The reason why I don't do the keto diet is I have seen, and I've used it. I will tell you, at one time I got below 6% body fat. I did what's called a cyclical ketogenic diet. I would go into ketosis for 4 days, and then I would gorge for 3 days, and I felt like absolute garbage, but I did get pretty ripped. But the problem is that you can't do that long term. People, one thing is that to achieve success in life is try to be normal, do something normal. Don't do anything too much or too little. The keto diet, even though it may give rapid results, the problem is people tend to fall off. When they fall off, they fall off hard. And you don't want people to fall off. You want them to stick with a diet the rest of their life. You don't want them to get sick again. Okay, that's the reason why I don't do that. Other people, although if you want to do it, go ahead. Just realize that when you want to fall off, go to the Page Diet. Okay, Page Diet's much more, I've been on that for years. Works awesome. The other thing that a lot of people talk about is intermittent fasting. Okay, and they say intermittent fasting does this and this, and they say skip breakfast. Most people are forgotten. They don't run blood tests. They don't run hormonal tests. When you skip breakfast, it messes with your hormones. Okay? I do not tell people to do that. Also, we used to call this binge eating. Okay? When you skip breakfast. I have seen a lot of people come in that are skipping breakfast that are messed up. Okay? It really messes with their hormones. I have one person who's really, really bad diabetic, and her doctor told her to do intermittent fasting. And even though her health improved, she is 10 times better now that she does the Page Diet and she eats breakfast. She is so much calmer. When you skip breakfast to basically break down fat, what happens is your body has to release stress hormones. Most people are already too stressed. Okay? You don't want to increase their stress. Remember, don't screw it up. That's why I don't do keto diet and intermittent fasting. That being said, you really want to do it. It's working for you. Great. Just remember when you want to fall off, go back to the Page Diet. Also, exercise. Now, if you're not exercising at all, just start. You can start walking 10 minutes after each meal. That will do wonders, and that will be enough. Okay? That being said, if you look at all the studies, they show that people really should be exercising about 5 hours a week. They say, well, what's the best exercise? The best exercise is the one that you do. By the way, we have a video on this too. You can look at that. We're going to have that below. But you need to exercise whatever you're going to do. I like to weightlift. I like to exercise in the morning. So what I do in the morning is I'll either run, okay, or I'll hit the gym. We have a gym downstairs in my basement. Or I'll hit that for an hour. I like doing that. That's what I'm going to do. I like hiking with my wife and my dogs. We go on usually 2 to 3 hikes on the weekends. and we'll do about maybe 10 to 15 miles. That's how I get my exercise volume in. Pick something that you can do year round. You know, people that just walk, okay, and they're like, I can't walk in the snow, ice, or rain, you're gonna have a problem. So pick a variety of things so you can do it year round, okay? Also, I find it's better if you do something daily. As an office, we work out every morning. Even though we only work out for like 15 minutes, it's enough to get things started, your metabolism started. When you put in a daily goal, when you put in a daily activity, a routine, okay, you stick with it better, okay? So try to do something every day. And you recheck those values that were off. Remember, we went over the fasting insulin, fasting blood sugar, HA1C, triglyceride, HDL, and the HOMA-IR. You can recheck those every month, okay? We do it all the time. It's when you do these steps, it's incredible how quickly your blood sugar will stabilize. Oh, all right. That's the video on blood sugar disturbances.